Hello, I would be more than happy to talk to your pharmacy students about xSBAR. My name is Pharmacist William Proctor and with me is Nurse Nancy.
Hello and welcome, my name is Nancy R and we will talk to you about xSBAR. Did you know that most errors made in the hospitals are rooted in communication?
xSBAR originated as a communication tool for the U.S. Navy with nuclear submarines and was brought to healthcare in the 1990s. xSBAR was developed for healthcare by Dr. M. Leonard and colleagues from Kaiser Permanente in Colorado, USA.
xSBAR is a technique to provide structure to communication.
At times with sentinel events or critical situations, it is imperative to make sure the communication is clear, concise and structured.
xSBAR can provide you a tool to do that.
Okay Nancy, let us demonstrate for the pharmacy students how we use xSBAR and how they will use it with Dr. Susan Fleming's Washington State University nursing students. Her students are currently in their first semester of nursing and they are from Spokane, Tri-Cities and Yakima.
First, the nursing student will email you, the pharmacy student, a scenario. Then they will arrange a time to call you, use Skype or meet you in person within 2 to 7 days.
As a pharmacy student, I will want to make sure that the nurse identifies his or herself and where they are calling from. Then I will evaluate the xSBAR scenario. So let's start. Well, it is 10 a.m. on a Tuesday morning and I am at the St. Helens Hospital where I manage the pharmacy department. I just tended to 3 West and orthopedic floor at the hospital and the nurses had no questions.
And there were no questions when you made rounds. However, the status changed for one of our patients and I decided to call you. Hello Pharmacist Proctor, this is Nurse Nancy R and I am calling you from St. Helens Hospital about our patient Bill Jensen.
Yes. How is he doing, Nancy?
Here is the situation. I am calling about our patient Mr. Bill Jensen. This morning at 9:30 he was extremely lethargic. This was a repeat of yesterday at the same time. Here is the background. Mr. Jensen has recently started insulin for his diabetes. He is now alert and oriented. He did eat a good breakfast on both days. My assessment is that I am concerned. His blood sugar was 77 at 9:30 and I feel that his insulin regime is not working. What would you recommend?
As a pharmacist, this is what I might be thinking. Ellipsis. Bill just started on insulin this week and this is a new medication for him. Since I know he had a good breakfast both days, I know it is not the food. Unless he has been vomiting. I will check with her to make sure. Otherwise, since he is lethargic 2.5 hours after he receives his morning insulin, I suspect that his regular short-acting insulin, which would peak around 9:30. Now back to my conversation with Nurse Nancy. Nurse Nancy, has he been vomiting?
No, he has not.
I see here that in addition to his long-acting insulin, his morning regular insulin is 60 units. Is that correct?
Yes, it is. You are correct.
Okay, I feel the regular insulin is too much. However, I would recommend reducing the regular insulin by 30 units and see how he tolerates this. Tomorrow morning. You would have to run this by his primary physician and obtain an order. Would you like me to talk to him or will you?
No, I will see his primary doctor in 1 hour and I will share with him your advice. Thank you for your help.
Pharmacy students, as you see, this dialogue was clear, concise and succinct. I will now give the nursing student this verbal feedback. Even though I will not be writing an order for the medications, I may be called upon by the physician or a nurse as a consultant. Remember to encourage xSBAR in clinical practice.